thing we're going to talk about is who are candidates for liposuction. Liposuction is definitely not a procedure that should be done for weight loss. Liposuction should be done for body contouring, and so we recommend for liposuction to be done for body contouring, and it can be as simple as a little small area in and around the waistline or the back, or pre-axilla area. Sometimes women will have a little bulge up in this area. A person I just responded to asked about the thigh area, and doing liposuction in the thighs, you just need to be careful. If you already have a lot of loose skin on the inner thighs and you do more liposuction there, it's going to cause a lot more loose skin. In and around the banana roll is, so in and around the outer thighs is okay to do. And you can slim down the outer thighs a little bit, but you have to be also careful in that area as well. Just because of the ligaments underneath the skin. If you lipo too aggressively, it's going to cause indentions in and around the thighs. But leg liposuction can be done. We recently had a patient that came in and he had liposuction done in and around the waistline because he works as in military, and in military you have to have a certain waistline. And he'd been working out and so on and so forth, but we actually did liposuction in and around his waistline area, which helped kind of trim him down a little bit. But we'd never do liposuction for weight loss alone. So if a person's coming in saying, I want weight loss, I want some liposuction because I want to lose 15 pounds, it's definitely not the thing to do. Exercise and eating well is the best thing. As far as what are the common complications with liposuction, a lot of people are concerned about the anesthesia and undergoing anesthesia. So first I want to talk about that. The best thing I feel to do for anesthesia is what we do in our office, which is IV conscious sedation with tumescence. And so what does that mean is that you're not under general anesthesia. You don't feel anything though at the same time. So you have the benefit of not going underneath general anesthesia where you're put on a breathing machine, but at the same time, you're able to have the procedure while you're asleep, but still breathing on your own. And so using anesthesia in that way, I think is a really, has a lot of advantages because you don't have to, it's not liposuction being fully awake, which some places do. We can do that. If a person wants liposuction fully awake, we can do that. It's not a problem, but I think you'd have a good amount of discomfort, and it can lead to the case taking a lot longer than it normally would just because the patient's so uncomfortable and you'd have to go slow in doing it. But if you're able to give the person IV medicine, which we do, that causes you to sleep but breathe on your own, and at the same time have the liposuction, I think is the best thing. As far as other major complications, there really isn't any. With liposuction, there's a small amount of blood loss, but the need for having a blood transfusion or anything like that after liposuction is very small. I think the most important thing to understand for the patient is the expectations and what expectations should be, or what should the expectations be after liposuction. And so if a lady comes in and she already has a lot of loose skin, and she's had some babies and there's loose skin in and around the abdomen, once you do liposuction, it's not going to generally tighten up that skin a lot. And so you got to just be careful in giving false promises to the patient that their skin's going to look super tight after liposuction, especially if they've had children and it's been stretched out. And so you know that your body's gonna tighten down, or your skin's gonna tighten down more if you have less stretch marks. If you have a lot of stretch marks, the skin's gonna tighten down less. So that's a very easy way to determine whether or not you're going to have your skin to tighten down. Now there's two things out there on the market to tighten skin down. One's called Body Tight, another one's called J-Plasma. And we have Body Tight here, and that does help tighten the skin after liposuction. It is a small additional cost, and you would want to do it in patients that have good skin though. If you have a lot of stretched out skin, even stretched out skin isn't going to respond as well to something like Body Tight or J-Plasma, which is working underneath the skin because that skin has been so stretched out. And really at that point, it's a good idea to get a tummy tuck if you have a lot of loose skin. The other things are your age. If a lady's older age, they're gonna have thinner skin. So if a lady's 60 or above, they're gonna have a lot more loose skin. Their skin's gonna be a lot thinner, not as thick, where a younger person's gonna have thicker skin, and the thicker the skin, the better it's gonna contract down. And so I think talking to people about skin laxity is very important. Now, if you don't have any loose skin and just some fatty tissue areas, you're gonna get the best results because your skin's gonna tighten up really well, and we're gonna remove the fat in those areas that it once was. I think it's also really important to talk about massage after. It's very important to do frequent massage after liposuction. If you don't get the massage and you're not getting massage after it, you're gonna have more lumpy, bumpy areas. And so when we do liposuction, I come in at multiple angles so that there's just not one track that's being created where fat's being removed, but we're removing fat from all directions over one area. Because if you have like a circle right here and you're only moving the fat from this incision area here, it's gonna be in one plane. But if we're removing fat from this area and this area, so you have multiple areas where you're removing the fat in the same area, multiple angles that you're removing fat in the same area, you're gonna have less chances of there being unevenness. We always check for unevenness by doing a little pinch test and checking the skin and making sure that there's evenness all around. But that's another important thing to really do is to massage out all those areas, so that if you feel a little lumpy, bumpy area, it could be fibrous tissue, and that fibrous tissue needs to be really thinned down with massage. You've got to break down those areas. The longer this fibrous tissue sets in, the more chances that area is going to be hard, and it's going to be harder to break it up. So it's super important to do massage, to really massage down those areas to give you the best results from a standpoint of it being as smooth as possible. The more areas of unevenness that you have prior to like the lipo, the greater chances there's going to be unevenness after. And so really, I come at it at all different angles. We take our time, but the best thing to do is wear compression. For liposuction, make sure you're in a good compression garment that's giving you good compression, and making sure that you're doing massage afterwards. The last thing I just want to talk about, and answer any questions if anyone has any other questions, but is afterwards, what to expect after lipo, where you're going to be swollen for the first few months after, but you really can get back to work within a few days. So it depends on what you do for your job, but the incisions are very, very small. So you're going to be able to go back really quickly from a work standpoint, because there is no large incision. But the main thing is you're going to be sore for a few days. So it depends on what you do, but a lot of our patients are like teachers or nurses. Within generally 2 to 3 days after liposuction, you can go back to work. It's going to be a little bit sore, but it's definitely reasonable to go back to work after a few days. As far as exercise, because the most important thing after having lipo is to maintain results, right? And so we've had some more people join on since I've started this, but I just want to say with liposuction and maintaining results, it's super important to continue to eat really healthy. Meaning do not, watch your carb intake, making sure that you're, avoiding a lot of desserts and snacks, and then also making sure you're doing a lot of cardio and exercising, because you're only going to improve your results and maintain results if you continue with that lifestyle. If you use liposuction as a contouring and afterwards you look great, but then you go back to kind of not eating well and exercising, you're going to gain weight in other places. And that's one really important thing that I want to talk to you about, is the fat that's removed. What happens after lipo if you gain weight? Okay, a lot of people have questions about this, and so I think it's very important. So the amount of fat cells that you have is basically steady after about the time of puberty. So once a woman goes through puberty, they're not going to have any more new fat cells. Their fat cells are either going to get larger or smaller or die, okay? And so if you have liposuction in and around maybe your tummy and your back area, that fat that's been reduced, that's been taken out, if you were to gain weight, you're only going to cause the fat cells that you currently have to get larger, but you don't develop new fat cells. And so if you're going to gain weight, if you have fat cells in like your legs or in your breast or in your arms, those fat cells are going to get larger there, but you're not going to accumulate new fat cells in and around the waist. The little fat cells that you do have remaining can get larger in and around the areas that are lipoed, but you're not going to get new fat cells. And so if a lady were to gain weight afterwards, that would be where they would gain weight after lipo. It's going to be where they had fat cells before the lipo, and those fat cells just get larger. So hopefully that makes sense to you guys. A person just asked, would you be able to tell through FaceTime consult if you're a good candidate for lipo and body type at 3 C-section to have a small amount of loose skin? Yeah, definitely. So we just did a consult earlier, just a few hours ago with a patient, and she was looking at getting a breast augmentation reduction after having some kids. And so we are able to do these consults, and basically how we're able to assess that lower abdomen area is just with you kind of bending over in a little piked position like that. We can see how much loose skin is there. So yes, we can. Please contact us. We'll put up the, or just email us at the easiest things to email us at patients, the word patient, like you're a patient with the S at the end, patients@newlifergv.com. And Vanessa, who's working from home today, will send you the information of doing that, but we can do that. So getting back to, results, and understanding the results. Results are going to be best seen if you continue to continue to exercise. And so what do you do during the time of COVID, right? How do you exercise? Every gym's closed. You're scared to go outside, and, with all the precautions we have, I'd highly recommend to go on YouTube and just to Google, or not Google, but on YouTube search home workout 30-minute fat burner. And there's a lot of them that come up, and just start doing one of those at least once a day, sometimes twice a day. That's going to help with results. And that's going to even help you get to maybe a place that you want to be to prior to having the lipo done. Any other questions you guys have, let us know. And we are doing virtual consults, and we can do virtual consults with you just showing us a few pictures, and be able to discuss with you whether or not it's better to lose more weight, whether or not you need a tummy tuck or so on. We'll be happy to help you guys. You guys have a blessed day. Stay safe. Appreciate you watching this.